Well, my dad came over here in 1979 and he sponsored my mom, my grandma, and I over in 1986. And ever since we were sponsored, we live in Westminster. So I've been living in Orange County since 86. I think when all of us in Vietnam migrated to United States, I think Orange County, because we have the little Saigon area,
Mm-hmm.
it just feels like right at home, right? So everybody
Mm-hmm.
migrate. This is like the place to be. Just like when you go to Vietnam, Saigon is like in the middle of the town. It's where everybody wants to be. And I think when my dad came over, originally he was from Kentucky, so he lives in Kentucky, but
Wow.
he figured we would not survive in the weather. I'm glad that he didn't move us to Kentucky, but he moved here. And so ever since then, I just like the weather. I just like the atmosphere. You just feel like right at home when you first came over. You don't feel so, need to assimilate, and there's no need to learn English right away, because the people you go, most of the time you go, you bump into somebody who can speak your language. Our organization is basically started out as a refugee resettlement immigration services, because we lost our country in 1975. So
Mm-hmm.
4 years later, a group of volunteers decided to form this nonprofit to help the Vietnamese that just recently immigrated from Vietnam. We've been doing social services, and about the 1990s, late 90s, the board just figured that we don't have a community clinic, so they open a health center. So we provide medical dental for the community. Fast forward to now, we're actually a very comprehensive, we're a federal qualified health center, similar to UCI. You know how
Mm-hmm.
you hear FQAC? So we're one of the FQAC in Orange County. We got this designation as a federal qualified health center in 2015. So we've been providing very comprehensive medical, dental, behavioral health, occupational therapy, pediatrics, women's health, anything you name it, acupuncture services. So we do a very
Mm-hmm.
comprehensive, we do transportation, we have seniors program, we have youth. So it's like a whole scope of services, whatever it takes. I don't know, where do we begin? So we got the shutdown order, I think in mid-March.
Mm-hmm.
And I have 3 locations actually. One of them is a health center, but the other 2 locations are non-medical sites. And so because of that, we decided to have to do like switch turnaround for everybody to telework within 2 days. We have a huge event this Saturday to actually pull together all the food, dry goods, resources to disperse to the elders. Because I know that they're like the population that they cannot get out of the house, they're
Mm-hmm.
isolated, they have no, like contact, right? It's really hard because I have a grandma who's 93 and I have my mom who's immunocompromised. She's 74, but
Mm-hmm.
she has multiple sclerosis. She's bedbound. She has hypertension, asthma, and all that. So even for them, I don't even get to see them often because I don't want,
Mm-hmm.
I want to protect their safety. And because of that, we feel all the seniors are being isolated, and we want to do what we can to actually give them that socialization as well as goods deliver. But you can tell when you see COVID, you learn, I'm sure you learn about your friends' personality, your family members. They all like, like it's very interesting where I have staff, I thought they're great. Through COVID, I'm like, oh, they're no longer great. And then the people that you think they're not that good, right? And then through
Mm-hmm.
COVID, you see their personality shines out and they become very, very helpful. So I think to me, any disaster or anything hits, you can tell who's your soldiers, who's your positive, your great folks, and then you can tell people who you think they're great, and then until this happened, and they became selfish and they just do things for themselves. So I
Mm-hmm.
think it just overall, you can't like there's no silver lining, but I see that you learn a lot from people personalities and how they live and how they care for each other through COVID. So just understanding the intergenerational,
Mm-hmm.
every culture, every generations has its positive. You want to learn and you want to incorporate all the good, right? You throw away the bad and incorporate all the good. And I think the cultural is very important, where your parents are coming from, your ancestors. The
Mm-hmm.
kids now need to learn that and appreciate, because I think the younger kids less and less, they're not very into history. They don't know the hardship that the parents or the generations that went through. Like for me,
Mm-hmm.
I'm in the mid 40s, so I hear all these war stories. I hear from my dad went to the war. I hear my great, like like at least you have that generation, but I feel like anything like the people younger than 40 now, they don't have that history and appreciate for the cultural.